This is Dr. Falaki Ashodi, and she's been kind enough to talk to us today about telepsychiatry and her experience of telepsychiatry. Um, would you let us know right now what first brought you to telemedicine and telepsychiatry?
Sure. I started telemedicine when I had my son, and I looked into it because I wanted to be home and present more. And I had also been at a crossroads where the clinic I was working for wanted to give me more hours and essentially wanted me to work more without paying me more. So I was pretty much at a crossroads in my career, and I looked into telepsychiatry.
And so when you were looking, you just had your child.
Yeah, I just had my son.
How late after training? How long after training was that? Was that pretty soon after training?
Um, I, I, I finished training. I had my son 1 year after training, and I started telepsychiatry maybe just 7 or 6 months after having my son.
How did you choose the company to work for?
Yeah, that took a lot of research because initially I thought of looking into doing telepsychiatry as part of my private practice. But then when I did my research, I just felt it would be too difficult to get the right internet platform, and EMR and such. So then I started researching different companies. And really, it was more of a list of what wasn't important to me. And what was important to me was to be in a company that possibly I could grow with, meaning that they had benefits and paid time off in case I ever wanted to go that route.
Great.
Yeah, that's how.
And you found that kind of company. Okay.
I did.
And you've been doing it about 3 years?
3 years now.
Wow. Okay. So, how does it give you a freer lifestyle?
Oh, I enjoy it quite a bit. I think, first of all, what's important to me is to feel independent. I also have a private practice, and I do other contract work. And I think that although I am employed by this telepsychiatry company, I think just by doing telepsychiatry, I feel that I can work any place that I want to, whether it's from home, from my office, or traveling, etc., etc. And I've negotiated the hours I want with the company such that these are hours that suit me. I'm not expected to work past those hours. And I think those are some things that are very important to me, especially with having a young family.
That's great. And so, what would you say are the challenges you found in setting this up and in the last 3 years? In the beginning, what were the challenges, and now what are the continued challenges?
So the challenges in terms of patient care would be definitely, one, follow-up. Although you may see the patient, it's not like you necessarily can call or find the patient as you would if they were coming into your office or to your clinic. This is done remotely, so you're really hoping that the staff on the ground is able to do the follow-up on your behalf. I think that's a challenge.
And so it depends on the quality of the staff in the ground.
It does.
Okay.
Very much does.
And have you been able to train some staff to really be responsive to what you want?
So luckily, I've worked in clinics who have great staff, and so that takes interviewing the clinic before signing to work with them.
Right, but not in telepsychiatry. Do you have a choice?
Yeah, so every clinic I've worked with, I've been on the phone with them. We've gone through back and forths before agreeing that this will be a right fit. And I've said
choose
no.
Your clinics. It's not the company.
No, I've chosen my clinic. So I've turned clinics down. I've said this isn't the right fit, and so that means I have to wait for
more work.
In the right fit. But it's worth it because, like I said, you're really relying on the staff there to be able to do the follow-up, or even simple things, to be able to say that, you know, X, Y, and Z person is coming in smelling of alcohol, or X, Y, and Z person came in with a boyfriend that didn't look like someone she should be with. You know, these are the types of things that my nurses will tell me.
That's great. That's great. So, tell me some situation that was difficult, like an emergency situation or something that was challenging, that might be something that some of the people attending this event might want to hear about.
So what I find very difficult is when I have an acute psychotic person in the room, because again, I'm relying on the staff to make sure they get the right services, like, you know, assisted outpatient treatment, and someone to follow up with them immediately, tomorrow, the next day. These are the type, and you know, you're doing telepsychiatry because they don't have services. So you're asking them to do things that they actually don't have services to do, but they need to do it. So that's where the difficulty is.
So moving on, so I know that we discussed telepsychiatry, and now you're thinking about there might be a time in the future where you might want to move.
Yeah.
And so how does it afford you that liberty and the ability to move?
So that's why, that's one thing I'm grateful about with telepsychiatry. I do feel more able to move because I do telepsychiatry. And I think also because I do feel connected with the clinics I work with. So I actually am happy that I can do telepsychiatry and continue to work with the clinics I work with. So it is a part of my job that I really am pleased with.
And they're going to offer you benefits?
Yeah, they're going to offer me benefits. Yeah.
Wow, that's great.
And again, like I said, I'm pleased also that the clinics won't need to find someone else. They went through so many years without. So it's nice that even though I move, I still be able to. Yeah.
That's really great. Have you ever gone to visit them?
I haven't.
Have you thought about it?
Yes, I have. Because, you know, even though it's telepsychiatry, you also have to remember that you form relationships with your nurses and the ancillary staff. So even though we've never met, I'm very close to my nurses.
Of course.
So yeah, I have thought about it.
That's great. What other questions do I have for you? So what about time? Do they give you enough time per patient?
So you negotiate that. Yeah, so I've negotiated that.
And so, I mean, sometimes I've heard stories where they try to schedule like 4 patients in an hour for a med check, and you just say no, right?
Yeah,
because it takes some time to type.
Yeah,
right?
you can't do it with telepsychiatry. It takes a lot more time to document. You can't do that with telepsychiatry.
And so how long do you get per med follow-up for an adult? Like,
I work in 2 different clinics, and for an adult, one gives me follow-up for 30. They both give me follow-up for 30 minutes.
That's great.
So
in an evaluation?
An evaluation, one gives me 90 minutes, and one gives me an hour. And the reason the difference is their EMRs are different. One really does need a 90-minute evaluation because the EMR is really intensive, and the other one, I can get through the evaluation with 60 minutes.
And you're doing e-prescribing with through Michigan? Then,
yeah.
Right.
Yeah.
Okay. And what would they give a child patient?
So you would negotiate that too, but they would do 30 and 90.
Okay.
That's reasonable. 30 and 90 is reasonable.
Yes, absolutely. That's great.
And if they don't, you don't have to. You negotiate it. That's reasonable. I think anyone would agree to do that.
Right. So great. So, where do you see telepsychiatry going in the future?
Well, honestly, I hope. Since I've done telepsychiatry, I've really gotten to understand that there is a real dearth of adult and child psychiatrists, and it's a real problem. So I hope to see it in more of the rural areas in America because there's a need, and the patients are just so grateful. The clinics are grateful, the nurses are grateful because the nurses are doing the work that they're not trained to be psychiatrists, but they're forced to do it when there are no psychiatrists around.
Well, thank you so much for participating
Thank you.
in this lecture, and we really appreciate your input, and good luck to you. Thank you so much.
Thank you.